Good morning, everybody. I wish you all a very warm welcome on this Sunday morning. I have been coming to Medicall since the past 11, 12 years, and I have seen significant changes in how Medicall is happening each and every year. Thanks to its brain, Dr. Manivandan sir. Sir has been always a big mentor for us, and he has been motivating us. This is my second presentation in Medicall. I had done a presentation a few years back. Again, for this topic, I thank Dr. Srivatsan also for recommending me for presenting on this topic. So, before coming to this topic, I am a second generation healthcare entrepreneur. More than that, I was a doctor, but I was made to become a healthcare entrepreneur. More than being a doctor now, I am a healthcare entrepreneur. So, I started my journey as a consultant surgeon in my hospital. Then I became the medical director and then even the trustee of our college. So before that, a small history would be good to know how this journey had started. So before that, this institution was completely established by my father, none other than Dr. P. Raju. He did his MBBS and completed it in 1974 and his MS in 83. He started this Kongunad Hospital as a very small 10-bedded surgical clinic in 1988 in the same area locality. Then the Kongunad Hospitals was formed. Hospital was formed in 1991 with the 75 beds. Slowly it was expanded in a phased manner. I joined myself in the institution in 2013. Then the hospital, now the current stature of the hospital is a 375-bedded hospital. We have allied institutions like Kongunad Kidney Center. We have a separate MRI center. And we have a separate 75-bedded Dhiran Chinnamalai block for neurology and pulmonology. And we have our allied institution, that is Kongunad College of Nursing and Kongunad Institute of Allied Health Sciences, which is catering around 600-700 students for nursing and allied health sciences. It is spread across 2 lakh square feet of building and hostels. It's present around 10 kilometers away from the hospital. So this is Kongunad today. Started as a 10-bedded surgical clinic, and it has now grown up to a 375-bedded hospital with offering 24-hour services across all specialties from head to toe, including cardiac surgeries, which is started in the recent years. Now, I have been given another task of again expanding this institution to the next level, that is Kongunad Super Speciality Hospital, which is a proposed 500 to 600 bed hospital, which is going to happen in the same city, again different premises. So this is the task for the upcoming next 5 years. So that task is mainly upon me. So already madam had given a short intro about me. I am now 38 years. I started my journey in the hospital as a surgeon during my 2013, that was when I was 27 years, I started my journey. Then became the medical director in 2016 and the trustee in the institution in 2018. So I'm just emphasizing on these points because this topic today is how can a generation 2 healthcare entrepreneur take over what was established by a generation 1 healthcare entrepreneur. Now from this history, you know that this institution was started from scratch by my father, who's sitting here as a generation 1 healthcare entrepreneur. And now it is being taken over by me, not completely, but I have been into the system and I have been running the show and I am able to manage what he does. In the past few years, I am able to do it myself alone. So all this was not possible in one day. It took me all these years. But patience is the key. Nobody will be given the battalion immediately, and that is also not the right thing for the institution also. So in this few slides which I am going to share you, I will just share you my experience and the challenges which I faced and the solutions which you can apply to yourself. See, this period doesn't change. If you are a 50-bedded hospital, maybe you can take over that in 2 to 3 years. And this number of years that you have to toil and you have to put yourself inside the system depends upon the how many amount of beds you are going to cater and how many departments you are going to cater and how many other responsibilities like other institutions like we have a college and all. So all these matters in the amount of years which you need to invest, but the process is the same. So the challenges for a second generation healthcare entrepreneur starts from school level itself and it goes on till eternity. Because you are always a generation 2 healthcare individual, that is anybody who is the son of a doctor or who is the son of a big hospital owner is branded as he is the son of the such and such hospital. So right from schooling, you are exposed to everybody telling that you are so and so. So you will be asked whenever there is a thing like there is a question to be asked, you will be asked first. Because they think that you know everything and you know you are exposed to more things. So right from schooling, things start. And even parents also say right from schooling, you are given an option only to study medicine. You are being told that you have to study doctor. Whenever as a child, you are asked like, what professions are you interested in? You would say, I want this, become this, that. And immediately they would say, no, you should become a doctor. So this happens. And in college again, faculties come to know, as an MBBS student, faculties will know that you are a son of the doctor. And again, you will be given preferences, you will be asked to answer questions, and you will be exposed to all kind of drama in college also. So I think most of the generation 2 healthcare entrepreneurs would have felt what I'm telling over here. Again, peers in post-graduation. So when I joined myself for my post-graduation in surgery, I joined, my MBBS was, undergraduation was in Coimbatore in PSG Institute. I joined as a management student. Again, I was offered a MS seat in PSG itself as a management student. But I told, first time I have joined as a management student, but definitely for my post-graduation, I don't want to go via a management student because, see, joining as a management student is not wrong, but I didn't want that brand, that I studied my MS or MBBS just by paying money. Even people have the image that when you are studying from private college and paying money, you don't deserve that degree. It is not like that. It is the amount of effort you put in during your undergraduation or post-graduation. Nothing is like whether you have got it under a merit or a management. But in my own home, there was some kind of rift because my sister joined MBBS via merit and I joined MBBS via management. So even my mom keeps telling, see, your sister and all had joined, you had wasted money. So this thing was always in my mind. So definitely post-graduation, I am not going to become a management student. I will go by merit. So my parents told, okay, we'll give you 1 year. 1 year, you do whatever you want. You try. If you're not going to secure a seat, definitely we are going to put you in management in the same PSG college because it is nearby our home. You can go daily, you can come and you can even see patients in our own hospital. It is a very good opportunity for you. Then I toiled 1 year. 1 year of no communication outside, 1 year of strictly learning, and I don't want to go inside that process. But I got a rank in All India. It was a 42nd rank. Then I joined Maulana Azad College in New Delhi. Again, I was told that in Coimbatore itself there was a medical college, and in Tamil Nadu, in Chennai, there are again options. I told. So I got a rank. I got one of the best ranks. I was the first person to take surgery in that 2010. Because in 42nd rank, everybody would prefer to join medicine or radiology or other subjects which are preferred more for a good rank. But I was the first candidate who joined surgery because I had a passion to become a surgeon, because my father is a surgeon. I have always As a child, he would take me during my vacations to the hospital. I would go and stand in the OR near the anesthetist. I would be standing and seeing. So I always had a passion on how he was operating. So I also always wanted to become a surgeon. So I joined surgery, and I told my parents that I got the rank. Now it is my time, and I will choose one of the premier institutes in the country. Then I joined Maulana Azad Medical College in New Delhi. Most of the individuals who are here as a post-graduation, who has done post-graduation, would be knowing the stature of that college. So I joined there. I did my MS and I finished it. During my MS, I am coming to this point because there is even during post-graduation, if you tell that you are coming from a big hospital, see, surgery is a skill where you have to scrub in with the surgeon. Whoever is operating, you have to join hands with him as an assistant surgeon. You get chances, you see how he is doing, you be the first assistant and you learn. But if you are not getting that chance, see, in an institution, there are 3 PGs. If you are not getting the chance to scrub in, definitely you are not going to learn. You might stand behind and see, but nothing like you are standing near the patient and you just see how he is tying the knot, how he is cutting the veins, how he is dissecting. Everything can be seen in a close by look. So I never told that I am coming from such a big hospital. None of my co-PGs or none of my faculties knew. And again, since it was Delhi, I never told them. They asked me, I told my father is a doctor, but he's having a small clinic. Even at that time, our hospital was around 250 bedded hospital in 2010. So I never told them. And my own unit chief was very much interested in having me there as a senior resident. And that is when I was very shocked, because I didn't reveal him. I told my father to come. You should come to Delhi. I am not I am not courageous enough to tell him that I have to come back immediately after 2013, because my father was expecting me to come back and slowly start running the show. So again, I came back and joined my institution in 2013. So there is this peer pressure during post-graduation also. Your postgraduate PGs, when they come to know that you have a hospital, you will be telling, you can go and operate in your own hospital. You give us chances now. And you will be pushed behind. So all these things are there. This is one challenge. And chasing your dreams. See, I always had a dream. My father knows. I always had a dream to be an IT guy. So that is why most of my things, even in my own hospital, most of my things was like, how in the hospital, how can we improvise information technology? How can we utilize information technology in the hospital scenario? I always had other dreams like photography, driving, all these things were there. But striking a balance is important. See, once you become a healthcare entrepreneur, because you have to become a healthcare entrepreneur to run the show, you should not restrict on your activities, because your mental thoughts and pressures will be suppressed, and you might get some unwanted depression, or you might feel sad, and you will soon develop a burnout solution or burnout situation, where you will feel like, see, I wanted to become this, that, now I am doing this. You will be fed up. So that is why you have to strike a balance between all these things. So I am implementing information technology in my own hospital, so that I am able to go inside the tech world also. And on weekends, I do some photography and do driving also. So this is how we strike a balance. That is very important. And professional and entrepreneurial challenges also come. See, after finishing my MS, I wanted to do MCH or a super specialty. At that time, I was told that, see, again, if you are going to go 2013, 3 more years, probably you will again tell that you want to study and secure the seat, add 1 more year, 4 more years. Then you will join here in 2017. Now probably 10 more years, in 28 only you are going to be in a position where you are now. So they told that, see, you are a surgeon, you know the surgical skills, develop on that alone, that is enough. Probably if you wanted, I wanted to become a gastrosurgeon, they told, we'll employ one gastrosurgeon. We'll employ one gastrosurgeon. That is a better thing than you going and studying again 3 years, 4 years. And seeing my father's health also, I wanted to, okay, let us start. And I stopped my journey with general surgery. So again, this is a challenge for Generation 2 healthcare entrepreneurs, where you might not be able to take the profession you wish and where you might not be able to go up to the level of what you wanted. Some even own generation to healthcare entrepreneurs. Your peer mates will be going to US, UK, they'll be doing all other courses, but you are locked down here. You can't go. Maximum I can go is for a refresher course for 3 days, 4 days, and I have to run back. So all these things are there. These are all challenges. Again, see, most of my slide backgrounds will be some pictures because I wanted to kill boredom, and most of the pictures will depict about what we are going to discuss in the slide. Challenges by family members. This is where everything starts. So first we'll see the challenges. Skepticism and doubt. Skepticism and doubt will be there for everybody. Father, mother, siblings, everybody will have skepticism and doubt. They will think, how can this fellow go? See, our father is such a big man. This fellow, how will he go and run this big hospital? My father is having some big hopes. He will do this, that and all. This fellow I know from the small East and West fellow, always sitting and watching TV, always going, roaming with friends. He will not do anything. So the skepticism and doubt will be there. Even to the own person who believe you, they will have the skepticism and doubt. So we'll see how to give the solution in the next slide. Financial pressure. Again, see, this financial pressure will be there. If you are finishing your MBBS or MS as a management student and you join your institution, you will have already a financial burden of 1 to 1.5 crores in current scenario. 1 to 1.5 crores of money would have been deposited in your education. That financial pressure is also there on you because parents, some might say on your face, some might say with hidden languages that you should start working hard, you day and night, I have spent so much of effort. That effort is nothing but money. So much of effort is on you, we have put on you, all these things. So financial pressure is there for generation 2 healthcare entrepreneurs. And lack of support. See, lack of support in the sense that you might have some new thoughts and new ideas, but initially, when you start your journey, you will not find support. It doesn't mean that you should not think about new ideas, new thoughts. You should have them and you should plan on how to implement it. That I will tell you. Expectations and comparisons. See, if you have an elder brother or an elder sister who is already a generation 2 healthcare entrepreneur, who is already working in your hospital, you will always be told that, see, your sister is going at 9 o'clock in the morning, she comes only by 11 o'clock, she is working so hard, we expect you also to do the same. All these things will be there, and probably if you both are in the same specialty or some different specialty, you will be judged based on the amount of feedback that staffs, patients, co-workers, everybody is going to give your parents. They will tell, today son came, he saw patients, everybody is happy. Today daughter came, she saw some patients, some were complaining, and some told that they want to see the generation 1 and they didn't go happy. So at home, in your dining table, all these things will be discussed. Emotional pressure. See, this emotional pressure, once you are married, once you have kids, any healthcare entrepreneur cannot have any time. You don't have time. There is no fixed time. You can't just go by 8 o'clock in the morning and return by 5 o'clock in the evening. Your phone's off, no calls, have a nice time. That doesn't happen. If you are a healthcare entrepreneur, 24/7 your phone is on. At least at my level, my phone is on. I get calls. Even you can't go and watch a movie at leisure. And you can't have a fixed plan. You might tell that I'm coming today evening for so and so. And definitely at the sudden moment, something might happen and things will collapse. And this will create emotional pressure and drift between your family members, especially your wife and kids. They will brand, dad comes, dad is always busy. Dad has no time for us. Even if dad comes, he's busy on his phone. No point of him coming with us. Why are we taking him? So this puts a pressure on us, and it makes us think like, why are we here? Why are we doing all these things? So we should we should decentralize these things. That we'll see all this on the coming slides. And generational gaps. See, what is the generational gaps? See, there is a gap between my father and me. when he finished MBBS, when I finished MBBS, when he finished MS, when I finished MS, and at what age he became an entrepreneur and what age I became an entrepreneur, and what was the technology available during his age and what is the technology available at the current time. So that whenever I go and say, why don't we do this method here, there will be always, initially, there will be always a skepticism and doubt. See, these things, I don't think it will work out. Because he cannot imagine the amount of technology that is available and how it can be implemented. So this generational gaps will be there. Over-involvement. So over-involvement, initially there will be over-involvement. All your whole family will be involved in all your activities. Every day you come back home, they will tell, today they told me that you did all these things like this. You shouldn't do like this. Your father always does things like this. You should do like this. So this over-involvement will be there initially. So how to find solutions? So clearly communicate with all your family members. You tell what is your plan. You tell your father, you tell your mother, and you communicate to them. See, if you don't communicate and if you just keep on fighting, nothing good is going to happen. Just tell them. See, I have studied this. I have gone through this technology. This is how it is done. And this is being implemented in this hospitals. And this is all the background data on this. And you convince them. Then you will have that support, which we saw in the previous list. And you will have less of skepticism and doubt when you clearly communicate them that this is what I am going to do. And educating the family. As I told you, educate the family members of your long-term goals, your short-term goals, how you are going to do things. And setting boundaries. Setting boundaries is very important because, see, whenever I come home, I never talk to my father or I never talk to my wife or my mother about whatever issues that is happening in the hospital. I never talk to them. Even if I'm on the phone, I'm shouting somebody, or if I'm on the phone, I'm telling something, my wife or my mother will ask, what is the matter? Just leave off all those things. Unwanted memory you are putting in your head and unwanted thoughts that will be running into your head because you don't know the whole scenario. I am sitting from... Suppose I am just telling the one thing about one person. They'll immediately think, suppose I am telling person X did something wrong today. Person X will be in their mind as a wrong person. That is not right. Because we know person X has been doing things, 100 things right. And today one thing he has done wrong. It doesn't mean that person X is totally wrong. But if we are going to go and tell them that person X did something wrong today, it will develop a wrong image to them. So why should we share all this unnecessary burden to them? We are carrying the burden. Sharing, yes, of course, sharing to them, if at all it is going to give you some emotional support for you, yes, please do share to them. But if it is not going to help you, and if it is going to unwantedly develop some discussions on what to do, how to do, and they'll be also be having all these doubts and all. So unnecessarily, don't burden them with unwanted thoughts and talks. Just set boundaries. When you're at home, you have your personal life. Whatever professional things that you're going to do, that keep it with you. Get external support and mentorship. See, support from your family, if you're lucky, like me, will be available from day one. My father did give me support from day one. My father, not my mother or sister, my father did. If you're not getting any support from your home, get external support. Probably you have your own senior, or you have your own friends who are again generation 2 healthcare entrepreneurs, or any other person who is again an established generation 2 healthcare entrepreneur. You just discuss your problems. Sir, I'm facing so and so issues. There is issue in the outpatient department like this. There is issue in the operation theatre like this. So how can we solve this? Some good mentorship. Not a person who is going to ignore you, or who is not going to give you any thoughtful ideas, or who is just going to tell you, this is how things are going to happen. You thought becoming a healthcare entrepreneur is a joke? This is how things are going. Don't have such a mentorship, because have a mentor who will motivate you and who will tell, see, slowly these things will go away. We can tackle like this. I am doing like this. You also try these methods. You can do it. Have a mentor like that rather than having somebody who's going to again depress you, or who's going to again tell you get lost from the hospital. Tell your father that I'm not going to run the hospital. Don't have somebody like that. And demonstrate commitment. See, this skepticism, doubt, lack of support, emotional pressures, this over involvement, generational gaps, everything will be gone once you demonstrate commitment. Commitment doesn't mean just you are spending time. Commitment means that you are showing results. You go to the hospital, you are doing something, and your hospital employees, patients, everybody is happy with whatever you have done. That is the commitment that you are going to show. Many people think that showing commitment is going exactly at 9 o'clock in the morning and coming back 10 o'clock in the night. What is the point of going at 9 and coming at 10 and then you are sitting there and doing nothing useful? There is no point doing that. Once you are there, you do something and you show a change, and the change will be reflected inside your family, and all these challenges will be lost. So show commitment, and this commitment, everything will come slowly on years of toiling inside your healthcare institution. So acceptance by patients. So once you are inside the institution, family challenges are all gone. Now challenges from your patients. See, some patients trust the legacy of the family. They think that father, son, everything transferred directly genetically, no problem will be there. Even if he is not studied, all knowledge is there for him. I am going to get treatment from him. So there is trust in family legacy. It is a good thing for you. It is not a challenge, that is a good thing for you. Inherited, that is what I told you. Inherited knowledge and skills. Patients think that all his knowledge and skills will be inherited. Even my own anesthetist says, I never knew. He says that whenever I operate, he usually tells that I see your dad in you. He might be wrong or right, I don't know, but to the date I have done some good work. He always tells, you are energetic like your dad. You are like a fearful surgeon like your dad. It is to motivate me, but I'm happy because he thinks that all the skills are inherited inside me. I don't know. And there is some resistance to change offered by some patients. There will be that resistance. Don't get fed up with that resistance. I am a surgeon, my father is a surgeon. I see a patient, I will tell, sir, this problem doesn't require surgery, or this problem requires surgery. And immediately what happens is that patient will be inside my father's OP. See, at that moment you should not feel bad thinking that, even my patients don't believe me, what is the use? If at all I would have practiced somewhere other than our own hospital, I will not be having all this comparison. I will not get a second opinion from my patient in front of my eyes in my own hospital, that too from my own father. See, all these things will be there, but you shouldn't take those things personally. Even you think about yourself. If at all you want to get yourself operated, you go to an institution where there is a generation 2 healthcare entrepreneur, you will think, okay, he has come now, let us get an opinion from his father also. So you will do the same for you, then why do you expect the others should not do that for you? So you should not become depressed, or you should not face it as a challenge. There will be a resistance to change, but change will happen, and change happened to me, it will happen to you. So you should build on the legacy. See, you should not go day in, barge inside and tell, from today, this is the current scenario and current technology is like this, I am going to change everything, no more this medicine, no more this surgery, no more this, that, no. You should not like, it doesn't happen. If you go and tell on day one, do like this, that, nobody is going to do. Even your own employees, your own family members, nobody is going to listen. So you build on the legacy and bring the changes then and there whenever it is possible, and in a slow paced manner. So again, to accept, get your patients accept, engage with them. Initially you don't think, your father might be seeing a patient in 2 minutes. You cannot see at the same pace. Patient, just like that, if they go in front of my father, they will have the feeling of seeing Venkatachalapati. Immediately they will be stunned. Whatever my father says, it goes into their head and they will accept it. It is not wrong. Because he has so much of experience, he can immediately diagnose even without any test, because they are a healthcare generation where there was no X-ray, no CT, no MRI, no ultrasound. So, but just by the history and just by the look of the patient and just by touching, he'll know what is the problem is. The same problem will be diagnosed by us by ultrasound, CT, MRI, everything. So patients do believe in them, and you cannot spend just the same. You can think, just like my father, I'm going to talk, and just like my father, I'm going to look at the patient. Patients will think, I met your son, sir. He didn't even put his hand over my tummy. He just talked to me 2 words. He gave me this tablet. I'm not confident over him. So it will not happen. So in the initial years, engage with patients, spend some time, get a proper history, get all the information, so that patients also feel that, okay, doctor has spent some time with us. Father, for the same 300 rupees, father talks only 2 minutes, son is talking for 10 minutes. It is good. And son is taking some test also. Nowadays, patient wants to do tests also. My father doesn't do unwanted tests. Even I don't do unwanted tests. But today's scenario, even if you avoid unwanted tests, some patients will tell, just like that they are telling they didn't do scan or no blood test, nothing they did. Just like that they are telling no problem, have medicine for 2 days. And even without our own knowledge, patient will be going outside some private scan center, he will be doing the scan. And there will be some unwanted stone lying here and there. He will bring that report and show us, sir, you told nothing is there, see one stone is there. I will tell, stones are there even on the road also. That is on the side of the road. But only if it is on the center of the road, it has some meaning. So don't worry about all these things. We tell the patient. So engaging with the patients, showcasing competence. See, initially, whenever you become a generation 2 healthcare entrepreneur, you have to showcase your competence in today's scenario. There are medias like Facebook, Instagram, YouTube. There are digital posters, digital media where you show your competence. I have did so many surgeries. I have did so many procedures. I have got this award, that award. All these things has to be showcased in today's scenario to the patients to make them gain confidence in you. And also, patients do come to you. They are very happy with your treatment. And nowadays, patients give feedback on Google, patients give feedback on Photo, on Facebook. All these feedbacks should be summarized and shared in your own outpatient clinics, in your own patient waiting areas. All these things should be shared so that other patients come to see that and come to know that, okay, sir is doing some good work. I think he is also good. Generation 1 is busy right now. Generation 1 doesn't come, and good that generation 2 is doing well. So patients should know about your good experience. So once you are inside the hospital, once you satisfied your patients, now slowly you should start becoming an entrepreneur. Entrepreneur is just not seeing patients, you become an observer. On the initial days, you cannot make any decisions because you should know what is currently happening in your institutions. If you don't know what is currently happening in your institution, you will not be able to correct something, you will not be able to implement something new, or you will not be able to remove something which is wrong. So, you become an observer for few years, starting from the outpatient department up to the discharge. You follow all the processes. How patient is coming in, how he is being registered, how doctor is seeing, how he is being given investigation, how he is going to the lab, in the lab where he is standing, where he is sitting, and how blood is drawn, how he is going for X-ray, ultrasound, CT, how he is coming for reconsultation, where he is sitting. So everything, even the minute intricacies you observe. And during this period of observations, you will get many points on how things are happening. See, sitting in my outpatient department, I know if a patient is coming to me and he is going to ask at 2 p.m., I want to do today itself surgery. I know how my institution works and I will tell. See, whereas another doctor who doesn't know all these processes, he will tell, okay, sir, today we will do. And patient immediately will go for tested and he will wait there and he will call me. On a complaint number, he will call me. Sir, doctor told today surgery, but it's 4 p.m. now, till tests are not over. Because I I have been an observer. I know what is the turnaround time for my institution for a surgical workup. I will always tell the patient, see, it's 2 p.m. now. We can work you up, but surgery is not possible today. Since it is an elective surgery, we operate emergency surgeries after 6 p.m. Elective surgeries are not done after 6 p.m. We can schedule you for tomorrow. So there is no negative feedback from the patient. So this is the advantage of becoming an observer. And only if you become an observer, you can run the show slowly. If you don't know what is happening, you can't change or correct it. So that's what I was telling. You know the existing processes, protocols, identify what are the good practices that are happening, identify what are the bad practices that are happening, and identify the areas of concern. And discuss it with your mentor. Mentor means generation 1, or mentor means either your friend or your senior. You tell them, see, this is how things are happening in my outpatient department. I see there is the registration process is not digitalized. Patients are writing on the paper, and the entry by the staff is something wrong. The phone numbers are not being updated correctly. Patients are not getting messages. All these things, many concerns will be there. So how can we change all these things? So you discuss with your father and you tell them, sir, currently there are kiosks where patient doesn't need to write. Patient can just come and type all these details, and everything will be fed to the HMS, and this registration process can be updated quickly. Probably your generation 1 will tell, okay, we can invest on the kiosk. What is the cost of the kiosk? Okay, do we have the space to put that kiosk? And will our patients, see, most important thing is, you can't implement something which is implemented in USA in your own hospital which is in Coimbatore or some village area, because people are exposed to more of technology there and rather than here. If you install a kiosk in some village and you expect that person to go and enter his detail, it's not going to work. You have to put a separate person standing near the kiosk and doing all this entry, that there is no use of that. Unwanted resources waste. So all these things you have to have a discussion with your generation 1 mentor, and then start implementing it slowly. So only if you become an observer, you can do all these things. Then comes the next challenge. You are into the hospital as an entrepreneur. Now there are employees in the hospital who are around 20 years, 25 years, 30 years, who have been working in the hospital. They see you as a small child. See, this fellow 15 years back, he was roaming here and there, he was running. He was cracking some naughty jokes and all. Now he has become a doctor and he is now telling us what to do and what not to do, and he is commanding us. I don't know whether what he is telling is right or wrong. I think his father has made a mistake. So there will be this initial issue of your employees accepting you as an entrepreneur. So you continuously keep running the show. And as we discussed, you build on the legacy and you don't do any changes to all the existing processes on day 1. Slowly get to know what are all the processes and slowly do the changes. You show competence and credibility. You make small changes. Those small changes will give them big results, and they will be happy to accept the big changes. You cannot do a big change in your institution on day 1. You make small changes, and those small changes will be shown to them, and they will be accepting your big changes. So this is how you overcome the resistance to change. Identifying key personnel. See, there are some key personnel inside the hospital. Every institution, if you take 800 employees, there are some 100 employees who are key personnel in each department, who have been in the institution for a long time. You have a good rapport with them, because if you don't have a good rapport with the key personnel, for example, in lab there is a key personnel. If you don't have the rapport with that key personnel will be your negative marketing person inside the laboratory. He will keep telling bad things about you. He will tell, that fellow is a cruel fellow. He is doing this, that. Now, everything is going to waste. You don't listen to whatever he is telling. Whatever he is telling, immediately you go to the chief doctor, you tell to him, and we will change that. So first you have a relationship with the key personnel, build a rapport with them, you understand their pain points, and you give some solutions for their pain points, and get to know how they are seeing the institution, how they would like to see the institutions, and you tell them, yes sir, we are happy that you have a vision to develop this institution like this. We both can join hands together and we are going to work for that. And all these things will make them happy, and they will tell, yes, I think our sir is very good. We shall all cooperate, and that one key personnel will motivate all his whole department to work for you, to work for whatever you are going to tell. Because if you are going to give an instruction and nobody is going to follow that, there is no point of doing that. You will feel frustrated. You will feel telling like, sir, today I went and told them to follow all these protocols. Nobody is following that. From tomorrow I am not going to tell anything. So this is going to happen. So to avoid that, you take hold of all the key personnel in the departments. Then initially be a bridge between the staffs and the top management. See, being a bridge between staff and top management is important, because all the junior staffs feel free to come and talk to you, because they might not be so free to go and talk to the generation 1, because he is such a senior person. They have seen all his anger, so they feel fear to go and express their thoughts, or express their concerns, or express their ideas. Even some new joined small employee will be there. He will have a brilliant idea, but he will not express it because there is a gap between the management and the employee. So that is not good for us. So be a bridge between the small staffs and the top management at the initial days, so that they you gain confidence on that. Keep doing employee beneficiary activities, like identify talents and hardworking personnel, reward them, and make some small existing policy changes. You can do like, suppose if there is no toilet facility for an employee in a particular area, make a toilet facility. There is no ventilation in an area which is giving them a very tough time working there. Give some ventilation, and they need some extra time for lunch, or some small things. You make those changes, all employees will start loving you, caring for you, and will start listening to you, and will start working for you. And recreational activities, we held year-end New Year programs, we held cricket match programs, volleyball programs. All these programs are there. So this creates a rapport between employees and between the management and employees. Again, identifying bad apples. Once you are inside the institutions, you will know there are some toxic people who are not to be in the institution, but who are in the good books of the generation 1. And they keep telling generation 1 is also having some emotional bonding with them, because they have been for all these years. Generation 1 will have an emotional bond. See, that fellow was born here, he grew along with me, how can I get him out of the institution? But that fellow is not having the same attitude. Slowly he developed the attitude of, why should I work for all this institution? The institution did not give me anything, did not do this, that. And he will be negatively motivating, and he will be creating a toxic environment in that department or in that workplace to all other newly joining junior employees. So once you identify these kind of toxic people, you talk to generation 1, because until now only generation 1 was there, and nobody was there to influence the generation 1. Now you are come as a generation 2. You can directly tell generation 1, this is not going to happen. If this person is there, and this is going to happen, and our institution is not going to develop. You put your foot down, and generation 1 will listen, and that will be the betterment for the institution. So identify bad apples and remove them. Again, upgrading your institution with the latest tech. First generation entrepreneurs don't have access or didn't have the idea for latest technologies like artificial driven technology. In the Hall 5, we are seeing so many technologies. So these kind of latest technologies, once it is implemented in the institution, your institution, patients, employees, doctors, everybody will get a confidence in you, and they will accept once this fellow has come, there are so many changes, and because of that institution is going to the next level. They are all happy with you and they are all supporting you. So being humble and approachable. See, once you are become an entrepreneur just because you had a generation 1. If at all I would have done my MS surgery, and in 10 years I will not would have become what I am today. Just because I was born to my father, I am what I am today. Okay, so always be humble for that. See, being humble promotes personal growth. It enhances relationship with your employees, also relationship with your family members and friends. It builds you trust and respect, and others will also come and join you, will collaborate with you and help you develop the institution, and it will give you even your own mental peace. So being humble and being approachable. If you are approachable, even the smallest mistake will be coming to your ears. It will not come to your ears when it is all blown out. Vicarious liability is there. Hopefully I have 10 more minutes so that I can finish on few more slides are there. See, once you have become a generation 2 healthcare entrepreneur, you should know what is vicarious liability is. Of course, once you have done medicine, you will know what is vicarious liability. Vicarious liability is whatever wrong or right that is being done by the grassroots level employee will be implicated on you. If he has done something wrong, it will be implicated on you. So, you know the legal responsibilities. Make standard operating protocols for all the activities. Know that everybody is doing what they should only do. See, probably since it is a generation 1 run healthcare institution, there are some things which are being done by non-trained people, non-qualified people. It happens. So there are some few staffs who are trained but not qualified, old staffs. But in current scenario, it doesn't work like that. Because any day, any inspection, if at all, if the staff or a doctor or anybody is found there, it can be an issue for anybody. So this legal responsibility we should know, and financial implications. See, once you have a mistake, and if it goes to the court and you are paying some hefty amount of fines, of course you have a insurance. Your premium is going to increase, and once you go to the court, everything is on paper, and all your public reputation, brand integrity, everything is lost. So all these things are there as a reputation management. And how can we overcome this? Is training, proper training, like how Gauri Shankar sir has developed a beautiful platform using his Explain. Sir has developed training modules where all staffs, doctors, junior doctors, everybody can be trained properly on how to do things in the right way. So these kind of training will avoid unwanted situations and making you becoming liable. What is Rajinikanth doing here? Preparedness for worst times. See, in today's scenario, worst time can happen in every week or every day. You will be thinking like today is going to be a good day. Once you go inside the hospital, you will get a call from your technician telling that, sir, MRI machine suddenly not working. Monday, 5 patients already waiting for MRI. Sir, what to do? Sir, suddenly one fire broke out, sir. Sir, suddenly one attender, big problem, sir. He is shouting in the pharmacy, sir. Sir, today water is not coming, sir. Last 1 week water didn't come, sir. We thought today it will come, sir. Today also not came, sir. Water is not available now, sir. What to do, sir? Sir, one small cockroach was found inside that sambar, sir. Attender took photos, sir. What to do, sir? So, these are all small examples I am telling you. There are so many examples to say. This is in my 10 years journey. My father has 1,000 lakh of examples to say. So, these are all small things are there. So, generation 2 should not be afraid of all these things. Slowly, you should start preparing yourself for the worst times. Suddenly an inspection will happen. Suddenly somebody will come. Suddenly many things will happen because so many departments are there. So, you should know what are the vulnerable areas And you should have an emergency operation plan. Say, like we have a thing called code white. Whenever there is a small problem, immediately they will be alerted. Code white in pharmacy. Whole hospital, all managers will go there and will stand there, seeing that small fellow who's trying to create a problem. And they will solve the problem, and the problem is mitigated. So this is how we have an emergency operation plan. This is a small example. If at all a fire is broken, if at all suddenly MRI machine is not working, what is the next plan? If at all this surgeon is not come today, there are so many patients posted for today, who is the next surgeon? So all these things you should have an alternative. Probably first few years, you talk to your generation one, you ask him, oh daddy, this has happened, what to do now? Daddy, this has happened, what to do now? Slowly, once you are in the system, now you will automatically know, okay, this has happened, no, this we can do. Last time dad told to do this, we will do this. So slowly you will be exposed to all these things and you will come to know. So the most important thing is, don't get frustrated in the initial times. Have a good communication system. My father didn't have it. Now we have WhatsApp. Immediately one small problem, it is intimated through our managers group and it goes through all the subgroups and everybody is aware of that problem. And we plan accordingly for that. The same example, if MRI machine is not working, the MRI technician puts in all the outpatient departments so that all doctors are aware. Okay, today machine is not working, better we tell the patient to come for MRI tomorrow. See, once doctor has told something, it is like a rule for the patient. Doctor has told MRI today, I will take MRI today. If you are not giving me MRI, I will go to that center and take and come. Only if doctor is going to tell, see, your problem requires MRI, but today there is some technical issues. We can take the MRI tomorrow, you take this tablet and go today, patient will go away. But if the same thing is told by the technician, patient will not listen. So these communication systems are very important. Resource management, just like in COVID, suddenly oxygen is not there, suddenly personal protective equipments are not there. So based on the sometimes some essential drugs are suddenly out of stock. So keep monitoring all these things, have a stockpile of supplies, and infrastructure and facilities should also be prepared for sudden issues like sudden power cuts, sudden fire. All these things in the infrastructure and facility should also be prepared. Alternative care sites. Suddenly if your cath lab is not working, suddenly your cath lab is down, you have a patient for emergency procedure today, you cannot tell the patient just to get discharged and you go away on your own. Patient will tell, you are telling emergency, based on your availability of cath lab only, I admitted this patient. I don't know, it is your responsibility, you should take the patient, you should do whatever right is. So you talk to your nearby hospital, you have an MOU with them, you tell them, in case of my cath lab is down, I will immediately bring the patient to your cath lab and I'll do the procedure with my own cardiologist and I will take back the patient to my own coronary care unit and I will treat it. You have an MOU so that institution is also ready to welcome you. Suddenly you can't call somebody and tell, I am bringing one patient to your cath lab. Nobody is going to accept it. So you have alternative care sites. So to improve is to change, to be perfect is to change often. I didn't say this, Winston Churchill said this. So keep doing SWOT analysis. What is SWOT? Everybody knows. Nothing new. You should know your strength. You should know your weaknesses. You should know your opportunities and you should know your threats. This should be done in a time-to-time basis because your strength and your weaknesses, your opportunities and your threats keep changing. Suddenly, one new lab will be coming near you. Suddenly, one new MRI center will be coming near you. Suddenly, one new ortho facility is coming near you. Suddenly, one new bridge is coming near you. Because of that, some patients are not going to come inside your facility. So, all these things are there. So, these are all threats. You find these kind of threats and you plan how to mitigate that. And some new opportunities are coming. One new apartment is being built up. One new shop is coming. So you ask your marketing team to go to the shop, you talk to all the employees over there, you talk to the management over there, you have an MOU with them. So all these kind of opportunities. Weaknesses, you know based on all your observations, you know what are your weaknesses, correct those weaknesses. So again, this is my last slide. Everybody knows this. This is from Bhagavad Gita. Whatever had happened well. Whatever is happening well. Whatever will happen will also happen well. What of you did you lose for you to repent? What did you bring for it to be lost? What did you create for it to be destroyed? Whatever you took from here. Wherever you go, you have given here. Whatever you gave, you have given here. Whatever is yours today will be someone else's tomorrow and someone else's some other day. The inevitable change is the law of the universe. So this is from Bhagavad Gita. In Tamil you would say, Edi unnoda ido, adu naalai mattavaroda idu appdinu varum. Why I am telling this is, whenever I started my journey as a surgeon in 2013 in my hospital, all the rooms, my father had put this Bhagavad Gita inside all the rooms. So whenever I used to go rounds, I used to see this Bhagavad Gita and everything had a meaning. In your day-to-day practice, everything will have the meaning. You just think about this. Once you know this, you will not be stressed. So with this, I thank everybody for giving me this wonderful opportunity to present in this wonderful forum.